Live from the Society for Radio Democracy 98.1 FM. Well, Body Talk na program we come to you every Thursday from 5 to 6 o'clock even time. Inside the program, well, Body Talk, we dey talk about different sick them, wetin dey cause am, treatment, sign and symptoms, and self-prevention. As we dey always get the experts na the studio with we, and inside this edition of the program, well, Body Talk, we guest now Dr. Geraldine George, and the Senior Registrar, Obstetrician and Gynecologist, Department of Obs and Gyn at the University of Salon Teaching Hospital Complex. And today inside the program, well, Body Talk, we dey look at comprehensive pregnancy care and the thing and way all belly woman for know. And me way they present this program, well, Body Talk come to you this evening. My name na Karifa to Conte. Remember, say yourself where they listen and watch we live na Facebook. You go get chance for be part of the program by why go send a comment or text message to the number 077921981 or self you go now Radio Democracy Facebook page. And later on inside the program, we get for open phone line so people go call the number 077921981 and ask question about the topic what they do today at the program when a comprehensive pregnancy care and the thing that we all belong woman for know. The program now, well, Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. Well, for can talk, but today this topic what they do it in the program. I want to welcome Dr. Geraldine George in the Senior Registrar, Obstetrician and Gynecologist, Department of Obs and Gyn at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program, well, Body Talk.
Good evening and thank you.
Okay, so Dr. George, before we can look at the topic today, we have comprehensive pregnancy care and the thing that we all belly woman for know. I want for more we start for talk about the department when are the Obs and Gyn department.
Okay, so the Obs and Gyn department of the University of Salon Teaching Hospital Complex, mostly situated at the Princess Christian Maternity Hospital, PCMH, working called Cottage. So now a whole department we get a stronger manpower now, ranging from consultants, senior registrars like me, junior registrars or resident, medical officers, house officers. So we get a whole cadre up to medical students then. And the aim in a follow we get a lineup of generations of medical students up to the most senior we can get for ensure say whatever teaching or learning they happen, whatever knowledge we acquire, will they pass on down to each generation so that knowledge will be uniform and the patient then will get the best.
Okay, so which role these departments don't they play in terms of pregnancy care?
So, as we all know, say Cottage now the leading or the main national referral hospital for all obstetrics and gynecology conditions. So any hospital could send to PCMH and where they can direct it to that department there. So they provide very good services. As I can say now, because of the cadre of doctors the way they do, the services are really good regarding the manpower, and it serves as a teaching platform. And recently, 8 of the doctors there will go sit in Ghana and pass the West African College of Surgeons exam. We make them fresh specialists. We get brand new 8 and they were all locally trained inside that department. They don't go train non-sign. They then train, then go then sit and they all pass, 100% pass. Right now, self we get still more. We get about 9 more in training towards Sunday. So training is ongoing and the department they do well.
Okay, so apart from the manpower where you mentioned, say, una get another department, now no look at una get the exact equipment the and facility where belle woman can go to hospital for make you go able for get quality care.
Yes, so in the last year, beaucoup people they don't come on board for provide beaucoup things they won't need. So for the things they will say stationary way fixed, like renting like a ultrasound machine, we get donors that we don't come, we don't provide. Okay, so then they fixed. And recently, the another partner provide what we call hysteroscope or laparoscope, when a small camera now then they put inside your belly for watch and no need for cutting again. So in the last month, then I made the ground breaking to me happen at PCMH. So for the things that we know about infrastructure and the things that we did, in the last year there has been improvement where they help planning. The things that were still a battle, now things everything like a consumables, see the way they use the way they done. But for the infrastructure, the things that we do, we are not there yet, but there has been major strides. and they make learning dey go on.
Okay, so this na a big platform now where we dey talk about well body business. So wetin are some of the things we lack na the hospital in terms of pregnancy care?
Okay, so I will say the regular and constant supply of all the medications, them supplies, consumables we go need. So meaning we might have for some time, and then sometime we go run out, another thing go there sometime, another time another out. So that's regular, constant supply of consumables na still we go need. For instance, we say right now one go do operation, all the drip they will need, on the antibiotics. So the doctor then go there like a consultant. But if we not get regular supply of that, they can bug the work. But otherwise, the patient and system they try forget what they need, and the care day. And because we know waiting for do some patient that we can not prepare them beforehand. Say if you get for need this,
so which means
this
they pay for the service?
No, they don't pay for the services. But if any consumable not available, then we ask them to go get them if we need them for them care.
Okay, so how you can access the pregnancy care in the country?
Okay, so it depends on the facility. I know say of late there has been an increase in the uptake of antenatal care, which is what we are hoping for, which is what we advocate for. So a person get belle, let go na health facility, outside and go take care of him belle te a born. And then they don't make where they pick up beaucoup medical conditions now. So if you see certain conditions that they rise or they happen more in belle, will they able to pick them up? It not necessarily means say it don't rise in the population, but it just means say that now they can hospital. So they actually get numbers and get data and statistics for Dandy, which is good. So we still get, some people they will still, I'm not going to use the word guys, but still get their reservations about coming to hospitals for various reasons. Some man, the experience is bad in hospital. Some man just get phobia for hospital. And some man just think say they can do it all because they don't get successes in the past. But we still advocate, say pregnancy should be managed in the hospital until delivery, and I think say they get better.
Okay, so how alarming the maternal death day?
In nationwide in the country, the maternal death they drop. We're not there now target what we're supposed for day, but at least we're not stagnant, but we they go down. We they go down for towards that low number day. And for PCMH, maybe if person watch we own statistics, go say a higher, but for a tertiary hospital, when I refer for the one country, you go say all the bad cases, as person see bad case, so you don't send and go cottage. So you go see some centers, they no go get no maternal mortality. Yes, it's a good thing because it can be said and managed, but it means say by the time the patient then get complications, they don't ship them off to it. And ideally, if all things being equal and if they come on time, we're supposed to manage them, we not get mortality, but there are sometimes you cannot go overboard and there is little you can do given resources.
Okay.
But generally, the maternal mortality they drop. And beaucoup things they were responsible for that, they from the numbers to the training, the residency training we go on to the manpower to the effort where everybody else they pull and put into the resources. We go try small.
Okay, so you na senior person we don dey na this medical field for very long time now. So what do we need in terms of equipment and manpower for say we reach with target?
Okay, so I feel say generally for the doctor-patient ratio, we know say e high, e low. The doctors are low compared to the number of patients the way them foresee. And the female population are a large population. And we population very fertile if you look at reproductive rates. So we're going to need more trained birth attendants. So not necessarily doctors.
Okay.
So we'll say trained birth attendant. Now anybody will get the knowledge and get the certificates for managed pregnancy, the delivery, and afterwards. And the one part of me thinks is very important for that definition. Now the side way say, and for able to recognize complications and refer immediately. So person go get all the knowledge, get the paper. If we then manage person in labor and pregnancy, not able to recognize complications, see when they above and for refer, then that person is not to train birth attendant. So we need more of them people than they cut across from nurses, midwives, doctors, they go cut across. So I feel say what we go need more and the manpower in all centers where delivery they happen nationwide.
Okay.
So if all man get access to a trained birth attendant, you go get safe antenatal care, you go get safe delivery. For equipment wise, it depend on the facility. Some facilities they within our rural areas, depending on the personnel where they you not go need for get ultrasound scan. Because if you put on there, you not go sabi use them.
Okay.
Yes, but you go get and wait e trained for use for manage patients there up to that level there. Where if you pass that level, they go refer to the next level of health center up the ladder, where then go get better equipment. So it go different for each facility. But if you say any facility where they see patients and they do deliveries, for get bare minimum for check patients, them conduct delivery and for refer.
Okay, the program now, Well Body Talk, they come to you live from the Society for Radio Democracy, 98.1 FM. Remember, say yourself when they listen and watch you live on Facebook, you go get chance for be part of the program by why you go send a comment or text message to the number 077981981, or self you go now Radio Democracy Facebook page. And today inside the program, we dey talk about comprehensive pregnancy care and waiting belle woman for no and the member say yourself can be part of the program by way you send a comment and text message to the number 077981981, and later on inside the program we'll go open phone line so people go call the number 077981981 and ask question about the topic what they do it then at the program. So now let's look at the topic proper way now pregnancy, comprehensive pregnancy care and the thing and way all belle woman for no. So now let's look at what you mean by pregnancy in medical term.
Okay, pregnancy, because they talk away woman gets belly. Okay, I feel say for this particular purpose, woman go they look at most of the time antenatal, especially we'll talk about comprehensive pregnancy now we person get belly. So if you get a positive pregnancy test, either from urine or either from blood, or you suspect them because you miss your regular period, yes, they'll assume say you're pregnant. So then the next stage will be, okay, who side the pregnancy day? Because it can be in the right place, it can be in a wrong place. So pregnancy is just being pregnant, okay. But for the purpose of this discussion and the one way go safe, where everybody wants way not a complication, now the pregnancy where they inside the uterus, when at the womb.
Okay.
Where if any woman gets done, they confirm them, and then we will confirm them by scan. Say it inside the womb. We'll confirm that they will say, okay, the pregnancy journey don't start, and we need a comprehensive care. So comprehensive mean everything in totality, the woman, a whole being, not only just that pregnancy day, because other things and they will the woman go get maybe other conditions day before you get belly. We go affect that pregnancy day. We get for look at that. Maybe some state of the woman now we pregnant go affect that pregnancy day. We get for look at the support where they get from a family, from a spouse. So it's a totality, and it encompasses boku from regular visits, from in checkup generally,
Okay.
to things that we go need for take in a pregnancy, like medicine or vitamins, them tests that we go need for do when and how we need for do them. I go plan the delivery, waiting I plan for the next pregnancy and how far they want space this one and that one day, who support they get from the spouse, who that they fund in health services and all that. So now to only say, okay, do my get belly go antenatal. It's a whole package, and there are different things at different stages.
Okay, so Dr. George, you mentioned pregnancy. You described pregnancy as a way woman they get belly through in uterus. So what are the causes where woman they get belly through in uterus?
Okay, so where the man in sperm go fertilize woman egg, where they don't form that small picking they if for travel can consider inside the uterus. Now do it in a normal position. Sometimes they can left na different parts, they left na the tube. Other parts na the belly where they can say ectopic pregnancy. Okay. Then they get different cause them. Sometimes the woman they way can don't do surgery where they don't touch them tube. Sometimes some addition, can call addition. Sometimes some string then cobweb then non tangle pan the tube. Some certain contraception person they use because it make the tube quiet. And for long man get belly, while the tube they move, so it go move that small picking they can inside the womb. So if the tube quiet, it possible say it go get that ectopic day. Then the woman they don't get repeated sexually transmitted infections. Them it cause it put at increased risk of ectopic because it go cause infection at the tube go swell. And are some of the risk factors. You know, mean say any woman we get anything and they would happen to they all go get ectopic. You know, just some of the risk factors and a few condition, a few patients and go come, but most of the patients in the pregnancy they inside the uterus.
Okay, so now let's look at what are some of the signs and symptoms of pregnancy.
Okay, so depending on the first trimester for like no first say or suspect say don't get belly. First, maybe you miss your period. If you get a regular period and if you say don't pass the time, then a one sign. Sometimes excessive tiredness, person go fatigue, they sleep fast, you just don't say tired, you just weak. Sometimes you can get breast changes. And sometimes you can get low abdominal pain because when the pikin they walk away the implants, you will get some cramping and all of that. So and then symptoms and they not they happen to everybody. They of course will get vomiting, they call early morning sickness.
Okay.
And all they happen to everybody. You go tell somebody go tell you say me three pikin they are born they all and not vomit one day. So all not supposed to be present, and you know also any rule say one has to be present, but now some things that we go put together. Okay, if you miss a period, they get this, then Lord do a pregnancy test. Then of course, appetite changes, either loss of appetite or increased appetite. Okay, some people then can get problem with the temperature. Either they just feel hot or feel cold at some point. Okay. Non-specific things. But if you count the history, say you miss your period in any woman in a reproductive age, the first thing will go and rule out a pregnancy.
Okay, so the first one where you mentioned, then are the signs and symptoms where you say where you miss your period, but you get some woman they say they see in period say 3 months of in pregnancy. So what can cause that?
Okay, so firstly, the period what they ask for, we go say okay, you miss your period. Now the normal one. So most people go say you last normal menstrual period.
Okay.
For somebody who is pregnant, it's almost impossible because they never say never in medicine for like you get regular normal periods while she's still pregnant. Okay, so if they see a period for 4 days normal flow, if you're pregnant it would almost impossible to get them. What think can happen where the pikin they can inside the uterus, they can't implant me say they can't fasten at the wall, and for fasten at the wall of the uterus it is scrape like where the insects and go they scrape like when they dig hole. So they scrape the wall of the uterus for like a fasten attaching safe. So during that scratching day, some blood is spill. So woman then go get spotting, but it not go last long and normal flow like a period. So it's possible because we call it implantation bleed. Where the pikin they try for implant at the womb, where they scrape, blood they trickle down. And then itself, by the time the uterus don't feel, the pikin don't take all the space, you not go bleed again. Because if you see bleeding after some particular time, now don't worry. But that early time, the implantation bleed is possible.
So what about the one where like they take contraceptives where it go there for certain months, you know, they see in period. So how themselves go able for no? Maybe themselves then God or don't get belly or not go able for no say now the contraceptives where they take make no they see them period.
So some of the contraceptive them now the mode of action and then they make ovulate, some they make get period. We now make some of them safe for some women they will get heavy period. We can prescribe some of them contraceptive day for reduce the flow and sometimes for stop at all. So if person they on contraceptive by right, the contraceptive with the person they take what they prescribe is supposed to be effective. We get a few percentage will go be failures, but then in the very unfortunate ones a one. So the reason why they give contraceptive and for the person not get belly. So if person they take contraceptive as is supposed for take them, then he get belly, then a contraceptive failure, which is very rare nowadays, honestly. Except so it happen if we take a history well, either the person skipping pill or do this or missing dates or something. Well, we can always tell her if you skip your pill or you miss this, you have to do this. But if you honestly on contraceptive method where they work adequately, not forget belle. If for any reason you suspect, you can always do a pregnancy test. Yes, then they go show you say you get belle or not. Then we can move on from there.
Okay, the program now, well, Body Talk, they come to you live from the Society for Radio Democracy, 98.1 FM. Remember, say yourself when you listen and watch we live on Facebook, you will get chance for be part of the program. By way, you go send a comment or text message to the number 077981981, or self you go now Radio Democracy Facebook page. And later on inside the program, we get for open phone line inside people go call the number 077981981, 077981981, and call and ask question about the topic they deal with today in the program when a comprehensive pregnancy care and the TNM we all belle woman for know as we get the experts in the studio with when our Dr. Geraldine George in the senior registrar obstetrician and gynecologist Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. As today inside the program well Body Talk we dey look at comprehensive pregnancy care and the thing we all belle woman for know. So doc, as we don't talk about wetin you mean by pregnancy and the signs and symptoms. So now let's look at wetin are some of the care then we possibly you don't know say you don't get belle for see say it gets that care for keep the pregnancy to the time where it go reach for born.
Okay, so it's different for each step of the pregnancy. So pregnancy generally we can divide that into trimester. I know some people don't go there and say first trimester, second trimester. Now like every 3 months. So like the first 3 months or the first 13 weeks, we go say na the first trimester. Then na early pregnancy, na that 10 day, they picking all in organs and they form small. They get small heart in system. They all begin small. Then begin form. And at the most critical period than day where the pikin they form, where we not want anything we go affect the pikin, let not come out abnormal. Okay. So for that first trimester, the way it's important, as I said, the first thing I follow we know whose side the pregnancy day. That is important because ectopic pregnancy is an emergency and it's a complication. So if we find out whose side the pregnancy day, that's now one, then we date the pregnancy. When we use the first 13 weeks for do a scan for no almost weeks that belle day, we dey able plan delivery. And this now one thing we boku belle woman and they get wrong every day. We go get for counselor, we get for talk because if we do scan at 9 weeks, we don't get dates. If you go do scan yesterday, it is tawapa you say no doctor, but this scan yesterday say na March 3 for born. The scan where they do early, the very first ultrasound where they do that first 13 weeks is the most accurate for dating. Because at that 10 day, all picking, no matter how that they born you, then they grow at a constant rate. They're all small. Later on now, picking they grow based on in genes. So if you're on the big side in parents and they're on the big side, it go grow faster. If in parents then small, it go grow slower. So for date pregnancy, now the first trimester, so that's important. One for no side the pregnancy day, and for date them accurately. Then we go take a full history of the patient. One know what everything will happen to you. Some man he don't get belly now, but until he get heart disease, some man get pressure, some man get diabetes, some man get sickle cell, some man get asthma. And don't mean say getting conditions you know and not go get belly. So even with the belly, we get take a history of all that day. Who surgeries they don't do in the past, whose medication they don't do in the past. You pass your pregnancy journey in the past, you don't give now miscarriages or you may born for yourself, how you may born, everything about the woman, we take a good history. We examine and totally in the first trimester is very important. I make as woman missing period, so ideally second month. 8 weeks, you go finally report in hospital. Let no side the pregnancy, then start the journey. So after we don't talk to the woman, we get boku tests we need for do because some of the women they now the first thing and they will they see them, especially the first time mothers them. Now the first thing and they so get for no boku thing about them blood group if they get sickle cell because it's complication can occur and then one day when blood group na negative, it can occur in woman they will get belly. So whenever we get woman with blood group resus negative, we get a different management road where they go.
So blood type also gets to do with pregnancy.
So in the management of the pregnancy.
Okay.
Yes, so they know your blood group. If you get a blood group when anything O or AB or A, once the rhesus na negative, we get beaucoup things that we get for monitor for because some complication they make it affect the baby.
Okay.
So important for low know that they will want to know if they get any infection like a syphilis, of course, HIV screening. We check the urine, we check the stool for worms, check for any infection, malaria, because it's endemic in we place. Then we check for hepatitis. So now a whole robust of battery of tests we get for do for them beloma, and important that first trimester day. So we don't document all that, and now we can use them now, and of course we then can check them pressure. Yes, so check the pressure, check the weight, check the height, because if person overweight too much, we calculate they are at risk of certain things. If person height too short below a certain level, they are at risk of certain things. So that very first visit day, we they do all that day and try to classify the woman into maybe low risk. Say, okay so far, by we all to don't do nothing, see any complications. So we hope say this pregnancy go progress. Or okay, we think say you get hypertension, so we put you as high risk. Or you may don't do 2 operations before you're in a high risk. Or you get twin gestation. Good, that is another thing where the scan go tell you almost picking in the inside the belly. So any belly we know to one picking immediately in a high risk, because instead of managing 2 people, you either manage 3 and above. Because if you're twins, and a mama, and if you're triplets, as the number they go. So all things in there as the first visit, they help you for classify. Also, they put the woman. They help even the low centers then for classify, choose other than they see.
Okay.
So if you didn't have one low hospital, I will say them maternal, then child health post. But I don't tell you this is my history. Don't tell you certainty. You don't do in test. Okay. You know they get no business for doing antenatal clinic. Okay. They send on a bigger hospital. But if you not get all the information, they will manage as normal.
Okay.
So that first visit today very important.
Okay, so not all women within a salon they able to get access to better medical facilities, or even some remote area they know they even get access to medical facility. So what are some of the basic things where the woman they for do for say they able for keep them pregnancy to the time they go born?
Yes, I know say in the country, okay, some centers then go they far, but some belly women can try for each day. And also get cool if not to center where they do delivery safe, it go be a maternal and child health post where at least they go do antenatal, but they need to do delivery. So where they can't close to delivery, then go refer you to outside go get. But at then center then go rely on them clinical skills. For instance, we watch if woman pale. Listen, go say make babuya pa me watch here, you watching palm, you watch under in foot. Then they rely on their hands. So sometimes I can say medicine most about with skills. And we would don't then teach your hospital. Sometimes they will not take the go lost the use of skills because quick we don't get scan. But then they don't have then centers and they rely on their skills. Then go able check the my belly, palpate and find say this became not an AD they carry it, which is what should happen. Or this not in size, or this size they look big or something at 2. So then they rely mostly on their skills, the examination skills, and refer. But at least all centers go able to check blood pressure. Where then go use for refer, then go able to take history. Okay. By waiting do man tell you go use for refer. So then self they use just waiting and get for shape do man into low risk or for refer to a higher center. And certain things away at that first point we see do man what we need for do. So we can see at first contact we first start do man on let's say tetanus toxoid for instance. Tetanus, not for saying for woman get belly no more. Actually, woman in the reproductive period for take up to 5 doses. But because we not get a system where like I go say woman and not get maclet card, so we get this pregnancy until we take 2. The next pregnancy come back, it take 2. So now that they above say by the time you done in reproductive years, you don't get you 5. But tetanus toxoid are not related only to pregnancy, just that within that reproductive years, if you don't take 5 doses. So at first contact, as you cancel, once you don't done, we started tetanus toxoid. We advise you on nutrition, waiting for it, how for manage, we try for manage the vomiting, because that's when they tend the vomiting in day. They complain nothing or they down. Sometimes we can able manage them, but some can get so worse, they can need admission, they can need to treat them, and certain people then they vomit more.
Okay.
The one they win a twin gestation, sometimes you can say if in a gal picking, some of the risk factors in a twin in a gal picking, we got a complication we can call gestational trophoblastic if that they happen of a molar pregnancy. But mostly for normal pregnancy, if woman they vomit, baku go suspect is it multiple gestation.
Okay.
Then later on, then can say something even a gal picking, but it can happen even if not so than the woman can vomit excessively.
Okay, so now let's look at wetin are the food and way belle woman for eat for say before keep up the pregnancy.
Okay, so really anything way you don't eat we don't keep you alive. It's supposed to sustain you, but just that for let you get a good balance. If you get a mix of everything, at least if you're able to get some carbohydrates, protein, and vegetables, and it depends on the woman in financial capability. I will go tell you someone say, I go find for it beef, protein, fish, kuta. Come on, so therefore be realistic. What's in there in our area, we settle the woman and go able to afford. You can tell and say, we're gonna market, but tell if they. The bar we bar not cook a done, make a like that pema so that you go get the flavor out of binge day, go able to binge mina day. So these are things a woman go able to afford. So mostly for settings, we go tell people them, but based on what people they able to afford, as long as they good protein, vegetables, fruits, then can eat just as they eat before. Yes, no particular restriction or they say, oh, because you get belly. Unless the one day we go say then they may get blood pressure and they don't tell them so okay for reduce the salt content, that is different. But just because you are pregnant, nothing or they will go say okay, no, it's this or no, it's this. No. We just want a good balance between carbohydrates, your proteins, your vegetables.
Okay, so let's take you back to the role of waiting at the role of traditional birth attendants them as themselves they play key role now. Remote area they must say belle woman and know they forget access to clinic and medical facility.
So now, which I think is waiting to happen, one thing say really not a stride in the right direction. Traditional birth attendant and know they deliver anymore.
Okay.
Right. We know say 2-3 tranga is good day. It no go done, but generally it's not supposed to be so. Then don't encourage them, then they work with the health facilities then. Because maybe the people then are the population at the village and don't trust them, we glad for that they would use that to the advantage of the people them. Say, okay, whenever this belle woman come to you for deliver, bring and come to the health facility. I know some time ago there was incentive for that. I don't know if it's still there. So for each belle woman you bring to the health facility when not deliver an OC, they get an incentive. So we really don't move. Yes, there are a few cases here and there, but by and large, most of the traditional birth attendants, they bring the patient them to the health facilities for delivery.
Okay, but we get some certain side in the way like ambulance or for make them get a motocar or even go to the belle woman hospital na big challenge for them. So if the birth attendants then they are also not able for deliver the belle woman.
So pregnancy and delivery na way even in the low risk patients like what say just now goes okay, this would think say pregnancy uncomplicated. During labor, anything can happen. If management. So the traditional birth attendants are not go safe for them for do deliveries where then they far away from a center where they go get advanced care. So if for instance, I know what is the maternal health post and they do, if the belle woman don't reach don't near for born, maybe a few weeks or left, then they refer them. So they go now to a big, now saying okay, they send you go na big town.
Okay.
They go don't tell you one thing. So okay, where the belly do 8 months, they send you go na big town. So from 8 months, they already don't push them to centers outside and go get delivery. So most of them post them, they're not just the antenatal care that they provide. If they see complication, then they refer. If not, where the woman they near to term, then they send them na the next level of care for delivery.
Okay, so before this will be the talk on the different food and way belle woman for eat for say then go be healthy to out them pregnancy. We don't see belly woman then they crave for eat dirty. Some will say you want for eat this, you want for eat that. So how healthy then thing then they be for belly woman then?
Yes, so then we call them picker. Now it mean abnormal eating habit. A normal symptom in pregnancy, then for people then back with them blood level low. So some man get dirty, ice. Then the most common thing in chalk. The most common things that people then can crave, dirty, dust, chalk, ice. So far, non harmful effects not on day we go say on the belly man or on the pikin. Okay. So in addition to that abnormal waiting the what we will neck for do now for test further, because as I said, then one day we can get low blood. So we just want to make sure, say, okay, this abnormal eating habit, is it only the pregnancy or is it that your blood level really low? If we think say blood level not low, not just the picker, we go manage it most of the time. Now for a short while, mostly that first trimester, like really terrible. Then later on now, people then can go out of it and begin eat normal food. Some can stick to one particular food till time. Some man from one grain cookery shop, we send a day for it every day.
Okay.
And it's food. Then afterwards, and say don't burn on, no one see that it's the safe again. So as long as it is food cooked in a clean environment, we have no objections to that. And then ice and other substances, not get any harmful effects we go cause to the baby during that pregnancy day.
Okay, Dr. George, plenty time on the year you say you get some certain food away you dey eat way you get belly way go make you picking clever.
Not so my knowledge.
Okay.
No, not so my knowledge. So intelligence depends on the genes.
Okay.
So depending mostly on the two people that we come together for conceive and get that picking in, and you go determine. It not necessarily means say okay, if we feel say two people they're not smart and no born smart picking.
Okay.
But you not get nothing for do with the food. Yeah.
Okay. So it's not the exact food way belly woman for eat so to say the belly go fine.
So as I say, normal food we eat a good cut of carbohydrate, anything rice, bread, protein from beans, fish, meat, vegetables. So they look almost plus with it. Only with it potato leaf green. And fruits. And different season they come. So just a mix of all of that. And if the woman not they eat at all, then we go worry. But as long as the meal way they eat for the day before you get belly, that is okay. Then the self go suffice during pregnancy.
Okay. Continue for the with me at the program. And name now Dr. Geraldine George, in the senior registrar obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. As in there so today for talk about comprehensive pregnancy care and the thing and we all belly woman for know as we don't talk about pregnancy signs and symptoms and say food then we belly woman for eat. So now let's look at the different causes then way the complications then way woman can get during the time when they get belly. Way one na miscarriage we think can cause that day.
Okay. So the causes then different. Okay. A greater percentage of the miscarriages not get non-cause. Like we investigate still, we not go see nothing.
Okay.
And most of the time, people then they miscarry their first pregnancies. Okay. We're not able to find out why and nothing, but most of the miscarriages no cause. That's not one. Second, it can be some infections. We call it touch. We get different infections. The way if the woman gets they miscarry, because the way the God programmed the body, anything way harmful or we not go survive or we not okay, the body they push them out. So then in a one infection, if the pikin self gets genetic abnormality, we sometimes we're not able to pick up on scan. Sometimes it's not so small, we're not able to pick up, but it's like not compatible with life. It will cause miscarriage. If the woman get complication inside in pelvis, until get big fibroids inside the womb, not to all of women will get fibroids they miscarry because they can they different side. But until if they inside the womb, the pikin not get side or them boku, the pikin not get side for attach, it will miscarry. So then can they the mouth of the womb, what we call the cervix, it can slack.
Okay. Because
where the womb the cervix na the stopper, they lock tight. Nothing they go inside, nothing they come on do until the woman born. But it can slack in some women then depending on the past until they don't do operation, they don't all the cervix or just some conditions where you born with no more, it can slack, then the pikin can come out.
Okay.
So a difference some day conditions the old man get if person get bad diabetes wey not control, it can affect the pikin, it can miscarry. Yes, some conditions the old man don't get before a get belle wey not well they take care of it, they make him miscarry. Now can make some man before a get belle wey is sick, they can always come for what we call prenatal care. That's okay. Some people then can say, okay, I want to go check. Let's say all is okay with me before I get belly. It is a good thing for do if you, especially if you get risk factors, maybe in your family or say you actually get some condition where you know well. So they come or prepare, say, okay, well if you get diabetes, you sugar for control up to this level before you try for get belly.
Okay.
Because if you try with this high level of sugar, you get increased chance for miscarry. Yes. Then multiple gestation but get an increased chance. We get past one pick, you get an increased chance for miscarry.
Okay.
So it's a different factor. Most of the time, we might never know why.
Okay.
Sometimes we go investigate and might find out why, and we go try for see the next pregnancy and prevent them if another particular one day.
Okay, so we get anything like where they say like this person gets light womb, because we don't see where plenty time where the woman they just get belly doing 1 month, 2 months. They say for ace this, for do hard work or with if you get light womb, the belly come out.
So I think say waiting people that they call light womb, now that's cervix, so they call cervical incompetence.
Okay.
So that means say the more slack. So instead of it tight, it's slack. So anything where all the small pressure can miscarry. You go see woman go give you history, say 3-4 times you don't miscarry a certain gestation.
Okay.
Okay, investigate, we check the length. Sometimes the cervix short. It's supposed for long, small, for lock the womb tight. So an patient then they then can say, okay, we get the next belly, then they go stitch the womb. So they go take thread now, pass around the womb now. We say safe stop around and stitch them. So it depends. If we find out saying at the cause, that can be done. But at other times, we can never know. Sometimes, now even paternal, now from the papa,
Okay.
sometimes some problem they in the sperm, whereby they fertilize the pikin, they cause abnormality, they miscarry. So different causes, but for every woman wake up with and we will take a history, investigate, and try for prevent harm in the next pregnancy.
Okay, so what's in the case of woman where they say don't do plenty abortion, that self can cause miscarriage?
Okay, so the one thing we go make it cause a risk for miscarriage now if the abortions the way do na instrumental. Some abortions can be medical. Someone a tablet somewhere they take, then everything come out. No theater, no instrument. But if repeatedly na instrument, then they hold the cervix. And the more every time you hold the cervix, it is short, it is damage. It is short, it is damage. So it lead back to that same incompetence. So that then go cause. But otherwise, some people then cervix go still intact.
Okay.
So many abortions in the past not equal to miscarriage in the future. But if it's not done properly and you don't damage the cervix, it might increase the chance. Or maybe there is a damage in the womb or something will increase the chance. But otherwise, if the cervix is intact and the PKA implant, no matter you don't do 3 or 3 abortions, if the pregnancy able to stay intact and the cervix intact, it will go up to term.
Okay, the program now Well Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. Remember, say yourself with listen and watch you live on Facebook. You go get chance for be part of the program by why you go call the number 077929191, 077929191, and the number for call and ask question about the topic we deal with today in the program. And we na comprehensive pregnancy care and the thing and we all belly woman for know. Or if you can go now we get the Democracy Facebook page and drop in your comments there as we get the experts in the studio with we. So the number for call and be part of the program now 077929191, 077929191, and the number for be part of the program. So Dr. George, now look at waiting at some of the causes again where belly woman and can say a born premature picking.
Okay. So, first, in pregnancy, we can say anything may don't happen in the past, it gets a chance to happen back. So, anybody may don't get a premature delivery for any reason the past can happen. So one type of people the way that they can happen to the one in back was they can get incompetent cervix, okay, miscarrying. Sometimes we don't manage for stitch the cervix, you can manage go tail, but it might not get to full term, then they might get a premature delivery. Sometimes the infection. Sometimes the infection can cause premature delivery. If the pikin gets abnormality, any congenital abnormality can cause a premature delivery. If in a past one pikin, if in a multiple gestation, because in a multiple gestation, the womb they over distend.
Okay.
So because of that, they go say it's okay. No, this I don't tire. It can get premature delivery. At other times, no cause, no care identifiable can get premature. So in real setting, we will call premature between 28 weeks and 36 weeks.
Okay.
And a prematurity anytime between that time there. And Bokuten and Kende, now same as a complication of real management. For instance, if woman carry with bad blood pressure or something carry with that eclampsia that fits. Elect another premature time day will get for deliver. So some of the time the prematurity now we self can cause them, but not at the expense of the woman in life. So if you get condition where you need for deliver before time, it will cause prematurity. If not twin them, it might deliver. And if the pikin gets any abnormality, it will deliver. If the cervix not strong and not locked tight, can deliver. If infections happen, can deliver before time.
Okay, so what is they refer to as abnormal pregnancy?
Abnormal pregnancy it mean as in the number of pikin there, or what do you mean by it?
The one like where they say this pregnancy is not normal.
So it go different for many things.
Okay.
It go better use the word high risk and low risk.
Okay.
Where high risk will be okay. Well, this pregnancy is there, but it is complicated by this.
Okay.
Okay, because pregnancy on itself, not so like a sick. So if person get condition, we're supposed to be able to manage them with the pregnancy.
Okay.
Waiting will cause abnormal in the beginning, what will cause ectopic. That is abnormal. But if the pregnancy they intrauterine, they're complicated by something else, we go say, okay, this makes it high risk. Maybe now the pikin lay down. Instead of an aid, it counts breach or a cross. That makes it a complicated pregnancy. Or if not more than one, that makes it complicated. Is it that maybe this person get diabetes or get pressure or get sickle cell? Anything else we come, they make a complication of pregnancy, but doesn't necessarily mean say the pregnancy abnormal. Okay. Waiting might be abnormal, maybe the baby on ultrasound scan, something go pick up some congenital abnormality. Same picking they would call them big head, hydrocephalus, they pick up na scan. Some picking they count with heart condition, we can pick up na scan.
Okay.
Yes, some picking they where they count with the bow legs, yes, so they pick up some of them in a scan. Some of them they compatible to life. We'll just tell him, mama say, okay, now this we see on the scan, so where you born you go refer. Some day you're not compatible with life, so we can cancel the woman and say, this is what we think. We'll not even think say the pikin might survive outside. So the decision is yours. We can wait till you deliver, or we terminate the pregnancy now. So the pregnancy might not be abnormal, but the fetus might be abnormal. But even a normal pregnancy can be complicated by many other things there. Okay,
the program now at Body Talk, they come to you live from the Society for Early Democracy, 98.1 FM. Call the number 077981991, 077981991, and the number for call and be part of the program. The number for call and be part of the program now 077981991, or self you go now we Radio Democracy Facebook page. So Dr. George, now quick one, waiting are stillbirth.
Okay. So stillbirth in a way pikin born in die one. Okay, as it is stillbirth. Okay. For we in America people there, we get we can grade them.
Dr. George, not
question on
this.
All right.
Good evening, name and inside call from. Okay, go ahead and ask the question.
Yeah, this is the question I will ask.
Okay.
I will just tell you, man, thank you for the time we don't take for the educational people and we will be listening. And for 98, 4 Nigerian people in they go to get in this country, but what careful for what man. The kind of man they explain is like I don't understand what.
Okay, plenty. Thank you for that contribution that we make na the program. The number for call na 077-981-981, 077-981-981, and the number for call and be part of the program. So, Dr. George, we talk about
stillbirth.
Yes, we don't get another call again at the program. Good evening, in name and who's the call from?
Yeah, good evening. I name Mahmoud. I'm present at dinner. But they really enjoy the program. You already know they analyze about no pregnancy. What you want to know about, we think you have to find a very difficult for record. Then the other thing I ask, the way someone can get the leg in the church. You understand? So I know that one you think you really calls back that one. Then you can really sort of begin really born here, they can't begin. Then we will have the Uber begin there. So I never know about.
Okay, plenty. Thank you for that contribution. The way don't make na the program. As this caller they ask, wetin can make woman can find it very difficult for making go able for born picking. Good evening, in name and who's the call from?
How are you? The phone number is somebody
Okay, go ahead.
Yeah, but like definitely I really glad how I'm study analyze this one on story. I just feel listen more and more. You understand? But like we talk about the man, you know, even if you look at the man they only pay and all that, some man they don't do 2 and 4, 5 years, you know, get picking, some man they don't do woman for them 10 years, nothing like that. So then people when they came doing that they don't pay anything or check what will happen. So then so we they know wherever they.
Okay, plenty. Thank you for that contribution. We again at the wait. Do for we na the program now where body talk they come to life from the Society for Radio Democracy 98.1 FM. The number for call and be part of the program now 077-981-981, 077-981-981, and the number for call and be part of the program. Good evening, your name and who's the call from?
I call from somebody.
Okay, go ahead and make your contribution at the program.
I mean
Okay, we don't lost that call at it. So Dr. George will not get better time again, so you can go straight, quick and respond.
Yes, so
to the
I know
question.
say the 2 callers they asked about the one they were able born. So that is a whole investigation for infertility. So
Yes.
we advise and cast a couple, both man and woman, we take their history, we'll run some tests them, know exactly what's the problem, we will intervene based on the cause. Yeah.
Okay, so if they talk about
Stillbirth, yes. So saying a way woman born, the pikin die. So at it means say at birth where them pull the pikin, no sign of life, then a stillbirth. For we can classify into 2. Either fresh, that means say this pikin less than 1 hour die.
Okay.
Until it just die in the belly before it born, so or macerated. Some can days 1 week you can don't die inside the belly before it born. And boku things and the way they cause down the way now some of the things so they try for pick up antenatal care.
Okay.
See diabetes, see hypertension. Hypertension 1, it cause boku stillbirth. So now some of the things that they try they manage for preventing or not reach there because there is no point going through a whole 9 months journey and get a stillbirth.
Okay. We'll go to another call on the program. Good evening, your man inside the call. Okay.
So now the doctor in contact now be one for no, they are making contact.
Okay.
Clinic, yeah, or the clinic was.
Okay. Okay, well, don't get it. Okay, so Dr. George, this one they ask. I think say you go show them how you go walk so that themselves will go forget a more waiting you go talk to them.
Okay, so the Princess Christian Maternity Hospital Cottage, where they run gynae clinics Mondays to Thursdays. So anybody they want, especially where they try for born can come. An antenatal clinic from Monday to Thursday back. So if you get belly or you want to know what for do before you get belly, you can walk in at any time, then go direct you to the right department and we'll go from there.
Okay. So let's take this one quick from Facebook for this one from Farrakhan UDC CDC. Thanks Dr. George and 98.1 for short and informative program. Well, we want to say plenty thank you to ourselves where they listen to we as this well body talk program na program will count every Thursday from 5 to 6 o'clock even time where you go know different thing them about well body business. So doc, this person again they also ask say impossible for let you get sex today with the person for the first time and the next day gets belly.
The next day, yes. So it depends on the woman's cycle. It depends on the woman's cycle. Sometimes it just meets the woman don't ovulate, and the sperm go fertilize. Yes, mean not about the number of times, but now at the parts of the woman's cycle. If you meet the woman don't already release a good
Okay,
egg.
is sex today they realize say the sex way sex today now you don't make it get belly the next day?
No, because it will take a while for let the sperm go up, go meet the pikin. It will take about 3 days for let kandong take the implant. So by the time they get positive urine test, at least it go down past 10 days.
Okay.
14 days at least. The earliest way you go see am by 9 days until you go see am na blood. But before 9 days, it go difficult, honestly. For let you say today, then you get pregnant tomorrow. No.
Okay.
You might count it back. You might sometimes we don't get belly later on. Now we they check your cycle, you go count back. So okay, maybe now that time when we get that sex, the next day now conceive. Yes, you might count it back, but you cannot predict say why I get sex today. Okay, then tomorrow I'll find out say I don't get belly. No,
Okay.
it's too early. The pikin not go to implant it.
Okay, so Dr. George, now you call free in the studio. Wait, it could
Yeah.
be message out there to woman for say day before. Take proper care for the belly.
Okay, thank you very much. So please, to all women the way they in their reproductive period, whether you're pregnant now, you plan for go pregnant before, or you sabi anybody who go and get pregnant. Pregnancy na a journey we already for work out with as healthcare practitioner, and no reason no dey for like get a bad outcome. We want good outcome for both mother and baby or babies. So as soon as you find out or you suspect say you get belle, can register antenatal. Please, Lord know if you get any risk, we'll go able to manage, we'll take you through the journey. We are not there also once at the country, but health-wise, but good thing they will go able to do. I'm not think say any reason for the way woman go say, hey, I the left salon go born because I feel say anything. Okay. For that day, we don't pass to that stage there. So just can register and you go get the care. We go pick up whatever condition you want to go manage her. So at the end of it all, you go get a live mother, live baby, and with the obstetrician, they will go happy. So please, in a camp, we not say it go be more work for we, but now work what we willing for do, and we ready for do.
Okay, plenty thank you for joining me at the program. And name now Dr. Geraldine George, in the senior registrar obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. As in there so today for talk about comprehensive pregnancy care and the thing that we all belly woman for know. And one for also plenty thank you for joining me at the program.
You're welcome.
Well, one for